Moving on to pharmacokinetics. We mentioned before about absorption, distribution, metabolism, and excretion. This is how medications travel through the body, how they are metabolized, and then excreted. We're going to go a little deeper in this section in regards to this. So absorption and distribution. Absorption is the process by which the unchanged drug moves from the administration site and into the blood. There are multiple things that affect this: the dosage form, the route of administration, the administration site, the presence of food in the gut or other medications in the system. Some terms we may see here include bioavailability, which is the proportion of the dose of the drug that reaches the systemic circulation intact, and bioequivalence, where two formulations of the same drug reach similar concentrations in the blood and tissues at similar times with no differences in their therapeutic or adverse effects. With distribution, distribution is the transportation of the medication from the blood to the site of action. Drugs are carried by the blood and tissue fluids to their action sites, to the sites where they are metabolized, and then ultimately to the sites where they are excreted. This is greatly affected by perfusion and blood circulation. Metabolism and excretion. Metabolism is the method by which drugs are inactivated or biotransformed by the body. Drugs may be changed to inactive or active metabolites or prodrugs. A prodrug is an inactive compound that is activated through metabolism in the body. Most medications are metabolized by the liver. However, some medications may be metabolized by the kidneys, by red blood cells, within the lungs, or the GI tract. Of importance here on this slide, oral medications only are subject to the first pass effect. Here you have extensive metabolization in the liver, and only some of that medication or drug is going to reach systemic circulation for distribution to those sites of action. And then finally, excretion. Here we have the elimination of the medication from the body. Primarily, medications are going to be excreted by the kidneys. However, some drugs are also excreted from the body in the urine, the sweat, expired air, or stool. Going back to metabolism, we mentioned that most medications are metabolized within the liver. Drug metabolism is a process of chemical modification of a drug and is carried out mostly by enzymes. About 70% of drugs undergo metabolism to some extent. The primary site for this is in the liver, but some drugs, the kidneys and the lungs may also be involved. Chemical reactions convert drugs so they can be then excreted by the kidneys. A major enzyme associated with drug metabolism, which is in the liver, is the cytochrome P450 family. This family of enzymes is extensive and has many different isoforms. Drug metabolism and the impact of drug-drug interactions are highly associated with this enzyme family. The rates of metabolism of these drugs are also affected by or impacted by genetics, environmental factors, age, and disease states. Metabolism is significant in determining the therapeutic and toxic effects of drugs. As mentioned previously, the cytochrome P450 enzymes function to metabolize compounds, primarily in the liver. This is important to drug metabolism, and the P450 system, it has been found to be highly significant in several drug-drug interactions. The isoenzymes CP1, 2, and 3 also play a role. This is important when we have multiple drugs in a regimen. It can increase or decrease the efficacy of certain medications. Alcohol and grapefruit juice also play a role here with this. Metabolism can either be increased or decreased due to this system. This can lead to toxic or subtherapeutic effects. Please view this video here on the cytochrome P450 system and its effects. Some other terms to consider here are drug levels and half-life. Half-life, the elimination of a drug is usually exponential process. So a constant proportion of that drug is eliminated per unit of time. Half-life is a major determinant of the duration of action of a drug after a single dose. Essentially, the time required to reach a steady state with constant dosing and the frequency with which doses can be given. Half-life is the time required for a serum concentration to be reduced by 50%. Most commonly, this is influenced by the rate of metabolism and the rate of excretion. With half-life, this is how we create our dosing schedule for medications. If a half-life of a medication is 8 hours, the dosing schedule for that medication should also be 8 hours, the time required for serum concentration to be reduced by 50%. Therefore, we're going to achieve therapeutic constant or consistent drug levels to maintain efficacy of that medication within the body to do what it is supposed to do. If the half-life is every 12 hours, the dosing schedule for a medication will be every 12 hours. In regards to drug levels are the amount of drug in the body at any particular time. This is mostly influenced by absorption. Why should we measure drug levels? We need to measure drug levels for certain types of medications in order to determine whether we are in a therapeutic range or if we are in a toxic range or if we are in a subtherapeutic range. So depending on where we are, subtherapeutic, therapeutic, or toxic, that is going to lead us to maybe have to make some changes in the dosing frequency of a medication.